The time is 5:26 p.m. on Thursday, September 9th, 2021. This evening's hearing is the official public hearing required by the Texas Tax Code, which we announced in our previous meeting on Tuesday, August 31st, 2021. Notice of this evening's public hearing was published in a general circulation newspaper posted on the main page of the Central Health website and has been broadcast on Travis County Television. The hearing will begin with staff's presentation of the proposed tax rate. At the conclusion of the presentation, we will invite comments from the public. To make comments during the public hearing, members of the public must either be physically present at City Hall or have registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. We will alternate between speakers who are on site at City Hall and speakers who have joined the public hearing virtually. First item, number 1, present an overview of the proposed Central Health fiscal year 2022 budget and its associated tax rate. Lisa Owens will be presenting, and this will be approximately a 5-minute presentation.
Good evening, Lisa Owens, Deputy CFO. If we can go to the next slide, I'll go straight to presenting the FY22 proposed tax rate. We are proposing a tax rate of 11.1814 cents per $100 evaluation. This supports our long-term look at the organization's current and future needs. It is an increase in the taxable value of approximately $39.75 to the average homestead value. And that is made up of a component both of the maintenance and operations rate and the debt service rate. The increase in the tax rate also takes into account the increased appreciation in taxable values. And again, the proposed annual increase for an average taxable homestead value is just under $40 or $3.50 a month. I'd also like to remind everyone that we do have the highest allowable homestead exemption allowed by state law at 20%. And in FY22, we did increase our homestead exemption for over 65 and disabled up to $100,000. And we estimate that will bring approximately $17 annually in relief to those homesteads. Moving to the next slide, we have presented our budget to the board and the community in a variety of venues throughout the process that we started back in April. However, I'm going to simply hit the highlights of Attachment A, our sources and uses tonight, and remind everyone that there is a full budget booklet on our website, as well as a community engagement report, as well as an archive of all of the presentations and the 2 community conversations that were held throughout the summer. So our proposed budget with that tax rate that we just discussed is $506.8 million in sources. Our primary source of funds are property taxes at $260.9 million. We also have lease revenue from the downtown campus, as well as tobacco litigation and other revenue. We estimate our other revenue, our total of revenue, to be $280.3 million. And we do prepare a structurally balanced budget. Our contingency reserve carry forward includes $226 million, which will be appropriated as uses in the healthcare program in FY22. Moving down to the uses of funds, Central Health has 2 programs. We've gone through a great deal of information in June and August and earlier this month regarding the uses in healthcare delivery. Our healthcare delivery program is just under $0.5 million for FY22. Our administration and tax collection just over $15 million for FY22. Again, a structurally balanced budget, so we also have $506.8 million in our uses of funds. We do also maintain an emergency reserve of 15% of allowable resources, and that is at $38.7 million for FY22. Again, if we can go to the next slide, I'd just like to direct everyone to our website that has all the information that has been provided throughout the process. I will turn it back over to the chair. Thank you.
Thank you very much. The next item, agenda item number 2, receive public comment on the proposed Central Health fiscal year 2022 budget and its associated tax rate. Yvonne Davila of the Central Health Communications Department will briefly cover the guidelines for the public hearing portion of the meeting and will then call upon members of the public to comment. Once Yvonne has recognized a member of the public, please approach the podium if you are physically present, or if you are attending virtually, a member of staff will unmute your microphone and invite you to turn on your video if you wish. Please begin your comments by stating your name. If you are attending the hearing in person at City Hall, staff and signs at that location will tell you where to offer your comments. There is a 3-minute limit for comments per board rule. Yvonne?
Thank you, Madam Chair. And I will now read the guidelines for public communication for the public hearing. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail message 90 minutes prior to the start of the meeting. Individuals are asked their preferred language as they register to speak. In both the online form and voicemail greeting are in English and in Spanish. When called upon to speak, please introduce yourself by name before beginning your comments. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. And at this time, I will call on our first speaker, Ms. Ellen Richards. She is representing Integral Care. Ms. Richards?
Good evening, good afternoon. Ellen Richards. I'm not able to turn on my camera, so I apologize that I can't show you my face. My name is Ellen Richards, and I serve as the Chief Strategy Officer for Integral Care. I want to thank the Board of Managers for your service to our community. We appreciate your dedication and commitment. The pandemic can offer many lessons, but one that stands out is that mental health and substance use challenges impact everyone in our community and cannot and should not be ignored. Rising suicide rates and deaths by overdose demonstrate the seriousness of the needs in our community. Central Health has partnered with Integral Care, government to government, since 2005 to make access available to mental health crisis services. In recent years, investments expanded to support a collaboration between community care and Integral Care to provide medication-assisted treatment for people experiencing opioid disorders. And most recently, we've been working through agreements to make medications more accessible through MAP. We are grateful that Central Health is continuing its commitment and expanding to support more behavioral health services in Travis County. Additional investments in mental health and substance use treatment are needed now more than ever. And I just wanted to thank you for your time and commitment to the people of Travis County and your recognition of the importance of these issues.
Thank you for your commitment to our community.
Thank you, Ms. Richards. Our next speaker is Michael Lofton, representing the African American Youth Harvest Foundation. Mr. Lofton.
All right, I got my mic on. First and foremost, thank you for having me. Again, my name is Michael Lofton. I am the founder and the executive director for the African American Youth Harvest Foundation, of which we have been in existence for more than 15 years here in the city of Austin, Travis County. I am here today to say, one, I support the proposal for the African American Men's Health Clinic. And I just want to take my hat off to the conversations that we've had over the last few days and weeks with Mr. Mike Geisler. We met with Mike over the last few days, and he's very receptive to the idea. Of course, he has to take it back to the board, but I just would like to invite the board of managers to come out or to be present to where we can present the full proposal to them. One of the board members spoke earlier, if the clinic was going to be available to men of color, Hispanic men. Absolutely. This particular program is going to be designed towards men of color from all ethnicities to be a part of it. But I feel we have a model, and I think it's time that we begin to take a look at how our systems of care are being delivered. And at the end of the day, I think we all know that COVID unearthed a lot of healthcare disparities, and it really highlighted the need for a new model of care for men, and especially men of color. And so I would ask that the board supports this here. We have been meeting for practically a year to be able to bring this proposal to the table. We have a number of folks and entities on our steering committee. So I would ask that you all consider the proposal. I've enjoyed working with Mike. We have over the last 6 months or so reached out to all three of the FQACs. But I will speak to one in general. I'm saddened the fact that we reached out to community care, and to date, we have not had a written response back for them to participate. We have been in dialogue with Lone Star Circle of Care, and we are working with Regina at People's Community Clinic. But at the end of the day, I think it's going to require something new, something different. We can't say that we can fix this problem by either having equity discussions or diversity discussions. It's going to require a new model of care. And I just want to be able to say that we have individuals in our facility that can help bring this here to fruition. We have a dynamic Dr. Kadir, who's been in family practice for the last 10 or 12 years in our facility, and she will be the medical director for this. We have mental health counselors. We have an array of social and emotional services available. So it's great that we can have all of these services under
Mr. Lofton.
one roof. If I was to say anything of concern, I move out of our building. Okay, I think my time is about up. But let me just say this here. I support it. All of the members come to our event on September the 25th as we talk about the launch of the African American Men's Health Clinic, because we hope that you all will support it. Thank you.
Thank you for your work.
Thank you, Mr. Lofton. Our next speaker is Benny Coleman, representing 212 Catalyst and also the African American Youth Harvest Foundation. Ms. Coleman.
Hi. So just piggybacking off of Michael Lofton, definitely here in support of the African American Men's Health Clinic. We have toggled on how to name that. Actually, we have from the beginning said African American and Hispanic, but men of color, understanding that these two populations in particular are some of the least likely to access preventative care. So the issues are not just about the clinic itself and delivering clinical care. It's about getting them to go to the clinic and appealing as people of color to people of color to create a space that feels safe for people to kind of enter into the healthcare system. And then we work, of course, with a variety of other providers to create a referral systems and networks. And we have a lot of pretty much you name the major institution in town. We have them at the table interested. Everyone has mentioned Central Health. So I think you'll find that as you do some fact finding and discovery that we have really done a lot of the conversations that you'll probably wonder, have you talked to these people, those people? And all roads have also pointed to Central Health, of course, as a major, major pivotal institution in the sphere. And just like Michael mentioned, the African American Youth Harvest Foundation and the social services side and the wraparound services side will be bringing that strength to this model. So it'll be more than a clinic. It will be a clinic supplemented by mental health trainings and workshops and services and peer groups, as well as the full-fledged wraparound service model that is already in existence, which goes everything from workforce assistance to, basic needs and holiday events. And a matter of fact, we've been partnering to do vaccination events. So this is going to be much more comprehensive in order to bring them in, and whatever point of entry that a gentleman comes in, he could be connected to all this array of full continuum of supports. And the Harvest Foundation as a social service agency is traditionally, even though the focus has been intentionally on African American, has traditionally served about 53% African American, and most of the rest is Hispanic. So just to give you a little bit of a understanding, we want anyone who has a need, and we realize that we all live in the same communities and we're interconnected. And so, we're welcoming of that. One of our biggest strengths is that just when you come in, your family, we connect on that level. And I think that's one of the biggest differentiators, as well as if you keep digging, I think you'll find that we have really a best-in-class team that is really trying to not just create a clinic that's great for African Americans, but really a top of the line clinic and comprehensive integrated model, period.
Ms. Coleman, you're at time.
Thank you.
Thank you for your participation.
Mm-hmm.
Thank you, Ms. Coleman. Our next speaker is Ms. Sharonda Robinson. She is also representing the Black Leaders Collective. Ms. Robinson.
Yes, good afternoon, Madam Chair and board members. I'm so excited to be with you virtually this afternoon to talk about the Black and Minority Health Clinic, Male Health Clinic. I'm the mother of 3 boys, and so I know how important this is, that we create safe spaces for Black men and Hispanic men to address not only their physical health needs, but their mental, emotional health needs, as well as we talked about it before, mind, body, and soul. We know that when we look at our community and we look at the outcomes, which is what the Black Leaders Collective is focused on, is how do we change outcomes for the next 7 generations? And we know that creating institutions that are Black-led, Black-conceived, and Black-serving will create a space for that transformation of health of Black men and Hispanic men to occur. And so we ask that you support, there's a request for money, funding to support this initiative. We know that you're looking at your budget right now and making those decisions related to your budget. And we ask that you say yes to that request for funding specifically for this initiative. The work that is being done is work that's being done on a volunteer level. It's work that's being done after hours and before work. And it's work that's being done to serve the overall health of our community. And so we know that you stand in alignment and solidarity in that. I also want to say to you tonight, you've heard the speakers talk about the model and the model of care changing. And that's really important. Black folks don't feel safe in the public health system as it has been designed, and we all understand the history of that. And so we have to interrupt that. And that's what that's what we're doing in this work. I also want to share with you that Quincy Dunlap with the Austin Area Urban League wanted to express his full support of the Black Male Health Initiative and the clinic that is being developed, and that we have about 100 leaders in Travis and Williamson County who lead all types of social service, community activists, organizations that have been meeting every month on this topic around public health and how we change the narrative and the outcomes for Black people in Travis and Williamson County. And we are also in full support of this initiative. So we hope that you join us, and we hope that you allocate more than what is asked for, because we know that it's going to take more than what's asked for to actually change the narrative on this. Thank you so much. And I do have a question. I don't know if I can ask a question about the budget now, or if I have to come back for that, Ivan.
I'm gonna defer to our chair.
And actually our legal counsel.
Or should I do the
You could also provide public comment during the board meeting, and we'll put that to the board, and then the board could address it in the budget if they wish.
I missed the first part, I'm sorry.
You could pose the question now or in public comment for the board meeting, and the board can address it if they wish in their budget deliberations.
Sure, I'll ask the question now if that's okay. I'm curious about the reserve budget and how that's being allocated. It looked to me like it's doubling from this year to the next fiscal year. And I'm curious about how those funds would be used, and if there are other, because we have lots of projects and lots of ideas to address public health in the Black community, and we're looking for those resources.
Thank you, and thank you for the information. And we can have staff address that during the regular agenda of the board meeting. Thank you.
Thank you, Ms. Robinson. Our next speaker will be speaking in person, and it is Pastor Leah Walker-Clark. She is with Texas Cross. Is Pastor Walker-Clark?
Yes,
Yes.
I'm here.
Great.
I had to walk from the back. Little old lady, you know, I take my time.
Not even.
Well, good evening, Central Health Diocese. It's good to see you all. I see some familiar faces. God be with you. My name is Pastor Leah Walker-Clark. I'm a Lutheran pastor. I'm a senior instructor and founder of Texas Cross, which stands for Texas Christian Recovery and Other Support Services. I'm part of the collaborative partner group that's forming itself to work as the collaborative partners to network the healthcare of the men that come to our clinic. And so I'm here to advocate for its launch and that you all support it wholeheartedly. It's shocking, but men avoid going to the doctor as long as possible. I see men in this room. If I tell you I'm 1 on the floor, all of you really don't like going to the doctor. And because of that, men are still just susceptible to the same things such as cancer, depression, stroke, diabetes, heart diseases. In addition to these risks, men also have unique issues such as prostate cancer and benign prostate enlargement. And they fear going to the doctor because there are barriers. It takes too long to wait for an appointment and get a little nervous if you wait for an 8 o'clock appointment and be seen at 9:30. And the system is multi-layered. Sometimes it takes you an appointment that you want to be in on a Monday and you don't get it until a month or 2 weeks later. Or that is just not conducive to your time. You work in the morning, getting up at 4 and have to be at work at 6 and getting off at 8 and just clinics are not open. In other words, our healthcare system right now is failing our men. The African American mental health clinic wants to shortcut that process and help men reimagine their healthcare and a delivery system that is designed specifically for men and allow men to the ability to seek healthcare solutions without the stress. The African American men's clinic wants to break the tough guy stereotype that you don't have to go to the doctor and you can just tough it through. Men need to think differently than that. We want them here longer. We don't want them dying at age 72 and 73 and 74. And given that the healthcare system today is failing them, we believe that this new healthcare model will give them what they need. The healthcare men can reimagine their healthcare at a time frame that they can go that will be conducive to their time schedules. They can be accountable for taking care of their own healthcare needs by knowing when they need it, know who to call, whether it can be done virtually or person to person. And we will be able to answer their biopsychosocial and their spiritual needs. The African American Men's Health Clinic is key to reimagining a better way of a healthcare delivery system. We believe that this clinic model will do it. It'll be the first in Austin history and definitely possibly in the nation. It will improve a steadier resilience for our men to know that they can have a cyclical space that they can go to and take care of their healthcare needs, improve their work-life balances, improve their spiritual and social well-being so they can become the public-private leaders we need. Thank you for your time.
Thank you for being here.
Thank you, Pastor. Our next speaker is Tyra Clark with the Black Leaders Collective. And Tyra Clark will be also speaking in person.
Good afternoon, everyone. Central Health Dias. I am here on behalf of the Black Leaders Collective and also Texas Christian Recovery and Other Support Service, AKA Texas Cross, which is one of the mental health providers in support of the African American Men's Clinic. In support today, I'd just like to say that this initiative has a balanced, reflective, intentional, and responsive approach that will help us rebuild trust in the healthcare system with this targeted group. Trust is a foundational and critical component of any healthy relationship and business transaction. Securing the necessary financial backing to ensure adequate capitalization will give us the leverage we need to be equipped to build and sustain trustful processes, which will ultimately be the catalyst for our success. And lastly, in Austin, we value what we invest in, and this is a great opportunity to prove that. Thank you so much for your time.
Thank you for the information.
Thank you, Ms. Clark. The last speaker for tonight's public hearing is Claren Williams with the Black Leaders Collective, and will be speaking remotely. Claren Williams. I'm not seeing them on, Madam Chair.
Okay. We will give one more minute just to see.
May I offer a suggestion? If perhaps he shows up.
I don't think we can do that in public hearing. We have to close it. Okay. Yeah. Yeah. There's the statute. All right. Well, any sign yet, Yvonne?
No, Madam Chair, no sign.
Because of the statute, we will have to actually close the public hearing. So not seeing anyone else. I want to thank everyone for their comments. We really appreciate the time that those of you in our community take to communicate with us, and it's very important to us. And so thank you for giving so freely of your time this evening. I'm now ready to accept a motion to close the public hearing.
I move that we close the public hearing.
Okay. Manager Valadez moves that we close the public hearing. Is there a second?
I second.
Who is the second?
Brinson.
Oh, Manager Brinson seconds that we close the public hearing. Thank you, Manager Brinson. All those in favor say aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, members. The motion passes, and we have closed the public hearing. So at this time, I will close the public hearing of the Central Health Board regarding the fiscal year 2022 tax rate, and the time is 5:55 p.m. The board will be voting on the tax rate in the Board of Managers meeting following this public hearing. We will now begin the Board of Managers meeting, and the time is 5:55. We will begin with public communication. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. Yvonne, did anyone register to make comments?
No, ma'am.
Right.
Not for the public communication.
Okay, well, thank you very much, Yvonne. Given that no one has registered for public communication for this portion of our meeting, we will now proceed to the consent agenda. Consent agenda. C1, receive and ratify Central Health investments for August 2021. C2, approve a contract amendment and renewal with JP Morgan Chase for depository services. Is there a motion? Manager Bell?
I move that the board approve consent agenda items C1 and C2.
There is a motion. Is there a second? Manager Jones? Manager Jones?
I second that.
Okay, so we have a motion and a second. All in favor, say aye. Aye. Opposed, same sign. Any abstaining? Seeing none. Thank you, members. The motion passes. We will now move to the regular agenda. We now proceed to the regular agenda. Members, agenda items 1 and 5 will not be considered this evening. Item 1 is not ready as Community Care's board has not yet finalized their budget, and there are no updates on item 5. For the record, these two items were, number 1, receive and discuss a presentation on Community Care Health Center's fiscal year 2022 budget, and number 5, receive and discuss updates on the 1115 Medicaid waiver, delivery system reform incentives payment, open paren, DSRIP, close paren program known as DSRIP, and associated projects, the Community Care Collaborative, and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas. Managers, at this time, I will entertain a motion to limit debate for all items in the regular agenda for our meeting this evening. Manager Bell?
I move that the Board of Managers limit debate on all items on the agenda to 3 minutes per member per item.
There's a motion. Is there a second?
I second.
There's a motion by Manager Bell, a second by Manager Musaitov. All in favor, please signify by saying aye.
Aye.
Opposed, same sign. Show one and opposed, Manager Valdez, and
On principles.
on principles, okay? And any abstaining, okay? Thank you, members. The motion passes. We will now move to agenda item number 2. Discuss and take appropriate action on the Central Health proposed fiscal year 2022 budget. Jeff Knodel and Lisa Owens will be presenting. The total for these presentations should be no more than 15 minutes. And Jeff, I'm sure you will touch on the reserve item.
Sure, thank you, Chair Greenberg. Let me check, can you hear me okay?
You should probably speak a little louder.
Okay,
There you go.
does that sound all right?
Yes,
Thank you.
sir.
All right, thank you. So I'll be presenting tonight. Lisa Owens will also participate in the presentation. Empowering communities with care. We had a significant community engagement process that was deployed in our fiscal year 2022 budget process. And we included the results, the process and the results in our board packet that was attached. I just want to point that out, that even despite COVID-19, that kudos to the team that went above and beyond the call of duty to engage the community in our budget process. So we're here this evening to speak to 2 items that we're requesting action on. The first action item is approving our property tax rate of 11.1814 cents per $100 of taxable property value. And that rate is 6% above the maintenance and operations, no new revenue tax rate. In addition to that, we're requesting approval of both our fiscal year 2022 budget with $506 million of uses as presented multiple times by staff. And along with that, adopting the fiscal year 2022 budget resolution that was included in the packet. Next slide, please. So related to our fiscal year 2022 proposed budget, there are 3 primary strategic priorities that are involved in our budgeting process. Objective 1 is developing and executing healthcare delivery based on people in place. And that objective provides organizational priorities related to the construction of 3 health clinics in the Eastern Travis Crescent, Hornsby Bend, Del Valle, and Colony Park. Objective 2 is implementing a patient-focused and coordinated healthcare system related around delivering care to our community and our patients. And then objective 3, which is a sustainable financial model for healthcare delivery. Next slide, please. So as Ms. Owens spoke to our tax rate that we're requesting is 11.1814 cents. Again, an annual increase to the average homestead of $39.75. And then you see the split between the M&O, or the maintenance and operations rate, and the debt service rate. Next slide. So I'll turn it over to Ms. Owens to conclude the presentation.
Thank you.
Thank you. So again, as we walk through at the public hearing, I will go through attachment A, our sources and uses. Our sources of funds are primarily property tax and $13 million in lease revenue from the downtown campus. We do have total revenue estimated in our budget at approximately $280 million. And we anticipate having reserves available as a source of funds of approximately $226 million for FY22. We do prepare a structurally balanced budget, so our total sources and uses are both $506 million this year. We do have just two programs, healthcare delivery and administration. If we can go to the next slide, I'll walk through healthcare delivery. Our healthcare delivery budget includes intergovernmental transfers next year for the district program and healthcare services that we directly contract with providers. As we've highlighted in many of our previous presentations and in the strategic objectives that Jeff just talked through, this includes investments in new areas as well as existing areas in specialty care, healthcare for persons experiencing homelessness, behavioral health, and substance use disorder. The new initiatives are found in the primary care, specialty care, pharmacy, and post-acute care line items based on the service delivery environment. And this also includes our existing primary and specialty care that we deliver through our partners such as community care and the other federally qualified health centers. Our total budget for FY22 in healthcare services is $101.6 million. Next slide. Our healthcare operations and support includes our premium assistance program that enrolls high-risk patients in Sendero health plans. It does have a $1.8 million increase in order to enroll additional members next year. This section of our budget also includes the cost to operate our healthcare delivery departments at Central Health, such as our fabulous medical management team, our new clinical practices, and eligibility enrollment team. Internally, we did discuss and share with you in previous presentations that are all part of the appendix tonight, as well as on our website, about the robust business case process that we had for new initiatives and any new staff proposed in the budget. We have provided that detail by the functional departments with new FTEs, and that is in the appendix as well. Our total budget for healthcare operations and support is $56.9 million. Next slide. Our reserves and debt service. Our work in Eastern Travis County moves forward. We're very excited about this process and the work that is ongoing and continuing into future years. And we use our capital reserves to reserve cash for facilities and that we have budgeted for, as well as debt service when appropriate. As we've mentioned earlier, we prepare a structurally balanced budget and we use our contingency reserve for long-term planning. Also on our website and in our appendix is a great deal of information about the long-term look that we've had to make about the healthcare contingency reserve. And I think to answer the earlier question, we have a longer-term approach to the structurally balanced budget that appropriates healthcare services in the contingency reserve. The total budgeted debt service for FY22 is $6.2 million. And if we can go to the last slide, I will talk a little bit about administration and tax collection, just over $15 million this year. And it does include areas of operational excellence that we've discussed throughout the process of presenting the budget, and things such as potentially designing a new historically underutilized business program based on the findings from the Disparities study later this year. As I mentioned earlier, also all the administrative departments went through business case planning, and the details of those business cases, as well as increases by functional departments in FTEs and other areas, are found in the appendix and we presented in the past. So again, our total uses is $506 million. Last thing I'd like to just touch on, these next 3 slides, if we can advance, we do provide you with the contracts that we anticipate entering into. This is not exhaustive, but does provide the information that we need to ensure that we can present any conflicts today in the vote, but also the contracts that we are putting into this budget. So those are listed here, and you did receive those last week. We did arrange them by where we anticipate the funds being in primary care. You can go to the next slide. Specialty care of $17 million. And on the last slide, the other areas in the healthcare services that we talked about earlier. Going to the next slide. This is our calendar. We've come a very long way. And if we can go to the next slide, we are here tonight with the public hearing that we just completed and the board meeting to adopt the tax rate and budget. We will be going to the Commissioner's Court September 21st. And we have also, as Jeff mentioned, hosted the community conversations and have that very detailed community engagement report in the packet and also on the website. So with that, I will turn it back over to the chair and we're happy to answer any questions.
And Lisa, and to all the staff over, as you could see in the schedule, the many, many months that you have been hard at work at this budget and making presentations to us in our various meetings and also to the community. So we really appreciate all the hard work of all of the staff on this budget. And I know that it has been a very difficult year for so many. And we do want to tell you how much we appreciate you. Members, are there any questions? Manager Musaitis?
Thank you, Chair. And thank you for the presentation. Much appreciated. I have a request, if we can. You know, we've heard from several of our community members. Can you hear me? Can you all hear me?
Better now, better now.
Okay, perfect. We've heard from several of our community members, and also we understand the health disparities among African-American men, and that is well known. And especially now during this pandemic, COVID-19, we know the data is staggering. It's enlightening to know that African-American men and men of color are not being vaccinated at the rate we want to due to many reasons. So what I'm asking, if we can, if I can make a motion to add that we approve the funding of $213,075 for the African-American Men's Health Clinic with the condition to expedite COVID-19 vaccination for men of color in Travis County.
Yes, Manager Jones? Okay, so we have a motion by Manager Musaitis and a second by Manager Jones. Any discussion? Yes, Manager Valadez?
Yes, thank you for making that motion we're on. However, I'd like to know if you have thought about on our budget where you would like this money to come from? A contingency fund, maybe the emergency fund, what?
Yes, this will perhaps come under we have allocated $800,000 under,
Oh, the new projects
the new,
money?
under the new projects, if that's possible, or from a different allocation. Maybe Jeff or Lisa have other suggestions.
Manager Jones, I'm sorry, did you have anything else to add?
I guess my question is more process. I seconded because I wanted to get, is this the time for us to be dialoguing about actually the budget itself and making recommendations? I'm supportive of the motion, but I just don't know if this is just the time for us to do that, or we'll have time
No,
And
we
another
are, we are in the budget discussion at this time.
So now's the time to
Yes.
make recommendations for support of any and all new items.
We are, yes, we are
Okay,
on,
okay.
on the,
All right.
we're on the budget item.
In this
But
budget,
hold on. Manager Bell.
Thank you, Chair. I'm definitely in support of services toward men of color. I do know that they many times are not receiving the services that are needed to keep them healthy and to influence healthy outcomes. My question here is, how is this organization planning to spend the money? Have they worked with staff to develop not only a proposal, but to outline the exact activities that would be provided to this population and how they will receive these services? I think that it is most appropriate to fund such a project, which could receive national recognition at some point. However, I'd like a little better idea of the activities that we would be paying for and the activities that this organization would be providing. Thank you.
"21 years working for the city, I get up here and I have a mask that doesn't work." I want to be full disclosure here. I have, as a community leader in the African-American community, I've been working in support of this as well as many other initiatives. So my support for this effort is solely based upon my experience and working there. There is no personal financial gain or anything. I want to declare that personally, should that be a concern. Having said that, though, to Dr. Bell's question, I think it's a very valid question. My understanding, my expectation, I would hope that we would charge the CEO to work with the organization to develop such a budget that would be commensurate with what we allocate for monies, and that he would bring that back to us for approval at some point.
Mr. Giesland, I understand that you have had some meetings, but I also understand that there is a business case process, so you may want to speak to that.
Yes. So first, if I may, Madam Chair and members, to get clarification, what is the motion that's currently on the table?
The motion is to approve the funding of $213,075 for the African Americans Health Clinic with the condition to expedite COVID-19 vaccination for men of color in Travis County.
Okay, so it's for purposes of expediting the COVID vaccine.
Correct.
Okay. So I need to distinguish between, is my volume okay?
Yes, yes.
Well, I don't want to talk too loud, but I need to distinguish between the proposal that I was able to review this past weekend, and I think the motion on the table, which is for vaccines. The proposal that I reviewed this weekend is for a very comprehensive physical medicine, integrated mental behavioral health, wraparound services. I mean, it's a big scale endeavor at some point. So, but with respect to the vaccines for COVID, it would be, just making this up on the fly as I sit here, we would probably go back to the lessons learned for the equity incentive payments that we had for our FQHCs. And recall that we set aside $500,000. We spent, I don't know if we spent 100% of that, but we're also looking at extending that, but taking some of those lessons learned, turning to whichever organization is going to be the vaccinator of record, and making sure that the outreach is in place, that it's not just about plunging the shots. In other words, we would have to make sure that there is activities and operations that really will have an impact on communities of color with respect and men in getting this vaccine. So that's how I would look at this if what we're talking about is just the vaccines. Now, in terms of the dollar amounts, I think it would be set up as and I would just suggest this as a starting point, as a not to exceed. And so that as the vaccines are given and we see what kind of outreach activities, are they helping people get rides to get vaccines? Do they have culturally affirming outreach to encourage people to get the vaccines, et cetera, whatever that look like, then we would reimburse for that as the work is performed.
Yes, Manager Bell.
Actually, Chair, I'd like for you to recognize Manager Motwani, who's had it.
Oh, thank you.
You saw him.
Yes, thank you so much. It's hard with the hybrid model here.
Yeah.
Manager Motwani, please.
I'll defer. I was going to ask, basically, I was going to ask for clarification on what the process would be for using that budget in particular, and ask staff for that. So it looks like we're on our way.
Okay.
Okay.
Yes, now Manager Bell, yes.
So if I'm understanding the motion is really limited to providing vaccine or promoting the uptake of vaccine to African American and Hispanic men of color. I just want to make sure that I understand what the motion is about.
Yes, Manager Massager.
Thank you. I'll clarify the motion in place. So what I'm anticipating, there is a business plan that they proposed to Central Health.
Who's they? I'm sorry.
The African American Men's Clinic. So they proposed. Wasn't there, for Michael Lofton, wasn't there a business plan to Central Health with this ask of the
Okay, Manager Gies. I'm
Yes.
sure, Mr. Giesen.
So again, just to clarify, there's actually sounds like two separate issues that we're talking about here. If what we're focused on right now is vaccines, I haven't seen a business plan for vaccines. This would have to be put together, and we would again take our lessons learned with our prior equity incentive payment program and come up with as most effective plan as we possibly could. But also and I might be mistaken on this, but I don't know that there is a legal entity called African American Men's Clinic. I think what we would be looking for is there a provider of record that has access to vaccines that we could work with in the African American community to ultimately get the rate of vaccination up and have more equitable distribution of vaccines. And I'm sorry, Madam Chair, if I may, and whether that's formed under a new name consortium, for purposes of creating awareness and building trust or rebuilding trust, that's fine. I just don't know that there's an entity that goes by that name, but I might be mistaken. Because again, I've had a chance to look at this over the weekend and I'm just not fully advised. My apologies.
Andrew Jones.
And correct me if I'm wrong, Manager Massager. My second was based upon the understanding that vaccination would be part and parcel of an overall clinic service delivery model. And that as you look at what model that is presented to you by the African American Men's Foundation, that the vaccination would be one part of that effort. So the other component would be other services that may have been provided for clinical services by way of whatever mechanism has been in place. So my thinking would be, you would go out, you'd find out what that proposal is, that embedded in that would be incorporated what Manager Massager said, vaccination as well as other services. You would bring back to the board then a recommendation that would embed that, it would focus on men of color, African American, Hispanic, Asian American, Native Americans, and others. But that you would provide a proposal that will be incorporated in that. It's just so happened we're in COVID now. God willing, we'll be past COVID in
Yes.
a year or two. This clinic, we would hope, would continue way beyond then.
Thank you.
So that's my thinking. I don't know if that speaks exactly to Manager Musaifer's intention.
How are we on time? Okay. Briefly, Manager Musaitif.
On
Yes.
this item. On promotion, not the budget.
Okay, Manager Musaitif, briefly.
Yes, Chair. Exactly, Manager Jones, that is exactly my intention, is to incorporate that COVID-19 component into their business plan.
Thank you.
So thank you.
Did you have a question, Manager Bell?
One quick question. How have we determined that the activities that will be carried out by this organization equals that amount of money?
I am just going off with their request. The email, they sent us an email, so I'm going off that amount of money unless you have a different figure amount. So that's their ask.
Thank you.
May I speak?
Manager Brinson, please, you're on mute now.
My concern is that I'm pretty uncomfortable directly telling someone who is wanting to start a new clinic, something innovative and outreach, how to spend the money. I feel uncomfortable dictating that this money that they're requesting be spent specifically on this COVID vaccination. I feel that they have perhaps bigger fish to fry getting this clinic started, and so I would not be suggesting that we be so directive.
Manager Valadez, did you have
Yes.
some? And then Manager Zamora. So briefly.
Okay, briefly, I didn't understand that I thought we were, just for clarification from David Duncan, are we having this conversation about a motion that Manager Mustatif is presenting to us on something that we have not considered previously or seen, or are we having a budget discussion? Because if I don't see that we've had a budget discussion, and if we haven't had a budget discussion, then I don't want the time to be taken away from us for discussing the budget, because I would like to ask questions. However, if we are having this on and we are able to, historically, Essential Health has allowed for people to bring up motions and ask for funding. I appreciate that, Maram, as I have done in the past and been denied. I would like for you to consider adding an additional amount of money that will go to the Austin Latino Coalition, for who we do know since April of last year has been putting shots in arms to everybody and anybody, but especially they did target the Latino population. And I would personally like to see a collaborative effort for minority men. I don't want to say men of color, because I like to use minority men because it doesn't always mean race. So if you would add that consideration, Maram, I would wholeheartedly support that. But I do know that the Austin Latino Coalition has worked with some of those people in the past, members of the Latino Coalition. But I personally, I'd like to see if we can have a separate discussion on that and not here at the dais right now.
Okay, thank you. Thank you, Manager Valdez. Manager Zamora?
Well, the motion is well intended. I agree with Mr. Giesland that who's gonna give these shots? They're not a clinic like Dr. Brinson said. They're gonna have to get that vaccines from somebody else. They're gonna have to partner up with someone else to do these vaccines. And our central health, our community care clinics are doing a great job getting those vaccines out.
Manager Jones.
I know we're limited in time, but I want to make sure we're clear, though. I think I heard Manager Masaitis said that she was willing to incorporate a bigger concept in which a proposal would be brought to Central Health, to the CEO, for this funding of the men's health clinic, which would incorporate vaccinations. That proposal then would be part of another deliberative process by which we would discuss that after we've done our budget process, or incorporate that in our discussion for budget process tonight, so that we give direction to the CEO. It is our expectation we want those dollars made available as part of the 22 budget.
Manager Valadez. Yes.
This is going to be very short, but that would it would require, as Dr. Sona was saying, I would want to know who the nurses and the doctors are that are providing the shots in the arms. Who's going to be liable for all of this? Where is the vaccination going to be coming from, et cetera, et cetera? Is there staff going to be linguistically appropriate for the demographics that they're going to be providing services to? Who are they going to be? Where is their fluency levels, et cetera, et cetera? It goes to a criteria that is required of anybody providing a health service, because there is liability.
So what I'm hearing is you have lots of questions.
I have a
right?
lot of questions,
What's
and
the-
I support, I really do support the project, but I think that the questions need to be answered by someone who is sitting here in front of the audience, who has already vetted this with Central Health, and we have Central Health staff and them to answer any questions that we might have. If that doesn't exist at this moment, then I think we should temporarily put it off the table, Maram, and make sure that we, if nothing else, direct staff to incorporate or save part of that money for this future consideration as soon as we are able to.
Thank you. Mr. Giesland, did you want to comment on this?
Yes, thank you, Madam Chair. With respect to the budget, it's important to understand that any initiative with any clinic provider, I mean, just fill in the blank with any name of any clinic provider, that the funds for primary care, specialty care, the community health initiatives fund, post-transitions of care, all of that supports individuals receiving care through the medical access program. And there are collateral benefits. So for example, if we fund, like we did with some of our clinical partners on vaccines to try to have more equitable distribution, that word gets out there, right? And so it helps the whole community. Now that's on the vaccine front. But same thing on the healthcare front. And the way the budget is structured right now, there's ample funding and flexibility to do these different things. The issue, and I'm going to go back to something that I said in the executive committee session, is again, doing the diligence like you all admonished me to do, and bringing all of this back so that we can have these considerations. And it gets to where the pathway I think that Manager Jones has laid out, which is inculcate all this and bring all this back so that there can be a decision made. And so I think there's a pathway forward, but don't conflate setting aside a dollar amount, because in fact, when I met with African American Youth Harvest Foundation and Black Leaders Collective representatives yesterday, I made it very clear, you don't need to have a specific dollar amount in here for us to be able to do what we can do.
Right. Manager Bell.
Chair, I call the question.
Okay. There has been a request to call the question. So we are calling the question on the motion. There was a motion by Manager Musaitis and a second by Manager Jones. All those in favor of calling the question? Is that procedurally, David?
A vote on that, or you can see if there's if there's no objection to calling the question.
Is there any objection to calling the question?
Okay, you have to vote.
I just have a question about direction. I'm in favor of calling the question, but I think we need to do something about what we discussed at some point.
Okay.
I agree. So I am willing to withdraw my motion
Okay.
and to give direction to our CEO staff to come back to us, but to include a COVID-19 vaccination strategy for communities of color, especially amongst men.
Thank you. Thank
Thank
you for this very important discussion. And we look forward to, as Mr. Giesland said, in our executive committee that we had this evening, seeing this back before us in the strategic planning committee that Manager Bell chairs. So we look forward to it, and thank you everyone who has participated in this very important discussion. Anything else at this time, members? If not,
I just wanted to ask one quick question. Madam Chair, if you could maybe direct Dr. Bell to make this an item that the Strategic Planning Committee can incorporate.
I think, yes, Manager Bell.
Manager Valdez, in the executive committee, we have already put hold for an agenda item to discuss this strategy with regard to healthcare services for minority men.
That is correct. We did that
Thank you.
just earlier this
I
evening.
apologize. Thank you.
Best to make sure. Thank you. Okay. With that, is there any other discussion?
On the budget?
Manager Valdez, yes.
Okay, I was waiting for you to recognize me.
Yes.
Thank you, Jeff and Lisa and everybody else who contributed to this. I still have a couple of unanswered questions. I previously brought up the first time we were, the 2022 budget was unveiled and we were not allowed to ask questions. I asked, and I'm still waiting for a response to the possible liability on Central Health part regarding a CMS letter where they said we had possibly spent some monies inappropriately for inappropriate expenditures. To my knowledge, I have yet to have a conversation with anyone regarding this, and we're now voting on the budget. And the reason I asked it was because I wanted to know what the possible liability is for Central Health to know how much money we need to have extra in our budget.
Thank you, Manager Valdez. Mr. Giesland?
Okay.
Mr. Giesland?
Well, that's just one.
And we're going to stop there. Mr.
Okay.
Giesland?
Yes, I'll lead off and then ask if others, both present in the room as well as online, need to add any additional details. As far as legal liability, I recommend the board have discussions in attorney-client privilege, but Manager Valdez, I would point out, we have had these discussions and spoken to that very issue. And to the best of our extent, in consultation with counsel, have attempted to answer the question. I will say this, though, the CMS letter involved, and this is public knowledge, the CMS letter involves the state of Texas.
I understand that.
Yes.
I understand that. I just wanted to.
Not Central Health, yes.
The Central Health part of it. How much is the possible, which hopefully won't be, it'll be zero, possible liability
Yes.
amount. That's what I was looking for.
Understood.
Thank you.
Okay, and then my second, also I have asked historically whether or not any of the projects that we are considering funding are getting funding from other sources to do the same thing. I know, let's talk about our ACA component. The Foundation Communities just got the Federal Navigator Grant. That's a lot of money. And yet we have them on our books to also conduct ACA. However, we all know Foundation Communities volunteers who sit in their desks do not do outreach. They do not go into hard to reach populations. And so I'd like to know, and they're not the only ones I'm talking about. I'm only using them as an example. I'd like to know whether we have any entities that we're thinking about funding that are going to have possible duplication of services and funding.
Thank you. Mr. Giesland?
So I'll lead off with an answer. And Madam Chair, so that I can make good use of the board's time, let me just say, if I'm leading off with an answer, if you're staff in the room or if you're online, if there's additional responsive information, please chime in at any time that I am responsive from this point forward. Thank you. So back to answering your question, Manager Valdez, what we've done, and I can think of 2 examples here recently, is when we are approached and somebody wants to provide a service or they have an idea. There's some initial conversations, but let's fast forward and say that we get to the point where it really is about putting together some type of contract. One of the questions is, what are your other funding sources? And we ask that for a couple of reasons. One, for the reason that you just asked, to make sure that we're not diluting our funds for the medical access program patients, but also, to make sure that we're just not being a backfill to somebody's budgetary request, or if somebody is already paying for something that benefits our patients, that we're not double paying for it. So we ask those questions as part of our business processes. And I don't know that if I could answer the question, the second part of your question is, are we planning on contracting with anybody? That remains to be seen as to what other funding sources they might have.
For clarification purposes, and then I used as the example, Foundation Communities. I saw their name included in the
Yes.
ACA, and I know that they're the federal navigators. So that to me sounds like they're getting a lot of money to do the same thing that we're asking them to do, but they don't have to they do not do outreach. They do not get out of their desks.
Thank you, Manager Valdez. I think the time has expired. Thank you.
I'm just talking about.
Understood. Madam Chair, should I respond to the question?
Briefly.
Okay.
Yes. Yes.
I wanted to respond to the first part of the question.
Thank you.
Yes, please.
I want to make sure that you and other board managers receive a spreadsheet that we sent on Friday with the board packet. And in advance, we've received questions on the budget from board managers. I know there was, at least 20 questions. And staff worked to put together responses on the spreadsheet, and we attached it to the email we sent to each of you on Friday with the board packet. And I also printed a copy for you, Manager Valdez, so you should have that. So in regard to that question you asked about, I believe the CMS question, the note is that attorneys, because it is a technical legal question, attorneys are available for attorney-client privilege briefing with individual managers. And you could request a meeting with Brianna. And I believe we did try a couple of times to meet, but our schedules didn't work out.
They were on vacation or whatever. Yeah.
Thank you. That is very important information, and I'm glad that you clarified that. Thank you very much. Okay.
Well, then I apologize because I didn't read it.
Okay. Thank you. Anything else at this time?
I have to say so.
All right. If there are no other questions on the budget at this time, then I think that we can go ahead and accept some motions. Manager Valdez, did you have a motion to make?
I move that the board approve the budget items in the Central Health fiscal year 2022 budget and resolution that pertain to the University of Texas at Austin.
Okay, there's a motion. Is there a second? Manager Bell seconds it. And managers, I will be abstaining on this. I am a out of an abundance of caution, I am a faculty member at the LBJ School of Public Affairs, which is at the University of Texas at Austin. Okay, there's been a motion and a second. All in favor, vote by saying aye.
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 I did not say aye. Have it. Okay. Those, any opposed? Abstaining. So there are three members who are abstaining. We're showing
I was waiting for Clay Johnson to respond.
manager. Okay, so we're going to show Manager Greenberg, Manager Valadez, and Manager Jones abstaining. Thank you. The second, Manager Valadez, I think you have another motion.
I move that the board approve the budget items in Central Health Fiscal Year 2022 budget and resolution that pertain to the University of Texas system.
Okay. Manager
I second it.
Bell and Manager Musaitif, did you?
I will abstain.
Okay, so Manager Musaitif will be abstaining on this one. Okay. We have a motion and second. All those in favor? Aye.
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 Opposed? Same sign. Okay, any abstaining? So we're showing two abstaining, Manager Musaitif and Manager Jones.
Jones?
Chair,
Yes, and
I just wanted for the record, just say why I'm abstaining due to work and school with UT.
thank you. And
I was, the system, I'm assuming is part of the University of Texas Medical School also?
it's the University of Texas system.
Right, but that includes the University of Texas Medical School?
It's UT system.
That's right. That's why I'm abstaining.
Okay.
I'm waiting
thank
for
you.
the responses from Clay Johnson.
Thank you. Okay, Manager Musaitif, I believe you have a motion.
The board approved the budget items in the Central Health Fiscal Year 2022 budget and resolution that pertain to integral care and project access.
Okay, we have a motion by Manager Musaitif. Is there a second?
I think Dr. Brinson wants to second.
Dr. Brinson, yes, please. Thank you, Dr. Brinson. Okay, we have a motion and second. All those in favor? Aye.
Aye.
Opposed, same sign. Any abstaining? One abstaining. Dr. Zamora is abstaining.
I'm abstaining because I'm on two of those boards.
Yes. Okay, Manager Musaitif, I believe you have another motion. Can we hear, is your mic on?
Sorry.
There you go.
I move that the board approve the budget items in the Central Health Fiscal Year 2022 budget and resolution that pertain to People's Community Clinic and Sendera Health Plans, Inc.
Motion by Manager Musaitif. There's a second by Manager Valadez. All right, all those in favor?
Aye.
Opposed, same sign. Abstaining? Manager Bell, show Manager Bell abstaining. Okay. Did you want to?
Money here as well.
Manager, I think Manager Manager Motwani said something.
Manager Motwani? I'm sorry, I cannot make out.
Oh, I said I was abstaining as well.
Okay.
Did you hear? Oh, yeah.
Okay, so we have two abstaining on this, Manager Motwani and Manager Bell, correct?
And Madam Chair, the reason for the abstention is because both Manager Motwani and I are on the board of Sendero Health Plan, and I am also on the board of the People's Community Clinic.
Thank you. Thank you. Appreciate that. Okay, so so the motion does pass, and we show both Manager Motwani and Manager Bell abstaining. All right. Thank you very much, managers. Appreciate it. We will now move to agenda item number 3. Nope. Oh, sorry. Thank you. I think Manager Jones, you have a motion to make, correct?
Yes, I do.
Last but not least.
I move that the board approve the Central Health Fiscal Year 2022 budget as presented by staff and the accompanying resolution that was provided in board backup for all items other than the items related to the University of Texas at Austin, the University of Texas System, Integral Care, Progress Access, People's Community Center Clinic, and Sendero Health Plan, Inc.
Okay, we have a motion by Manager Jones. Is there a second? Second by Manager Bell. Yes? Okay. All those in favor signify by saying aye. Aye.
Aye.
Opposed, same sign. Any abstaining? One abstaining. Show Manager Valdez abstaining. Thank you, members. Thank you for the assistance. We will now move to agenda item number 3. Discuss and take appropriate action regarding Central Health's proposed fiscal year 2022 and open tax year 2021, close tax rates. A, total maintenance and operations tax rate. B, total debt service tax rate. And C, total ad valorem tax rate. And these will be roll call votes, each of these. Lisa Owens will be presenting and should only have one slide. Members note that this item is consideration of the revised tax rate for tax year 2021, which funds the Central Health fiscal year 2022 budget we just acted on. This is the tax rate only and does not affect homestead tax exemptions for residents over the age of 65 and residents who are disabled or veterans, which have already been approved by the Travis County Commissioner's Court. Ms. Owens?
Thank you, Lisa Owens, Deputy CFO. I would just share with you this slide again, which is our proposed tax rate with a maintenance and operation rate of 10.9204 cents per $100 evaluation, a debt service rate of 0.2610 cents per $100 evaluation, and a total rate of 11.1814 cents per $100 evaluation.
Okay.
Thank you.
Thank you very much. Members, anything else? Not, we have a motion then. Manager Zamora?
Right. I'm gonna remove my mask so it can be heard clearly. For the maintenance and operations tax rate, I move that the property tax rate be decreased by the adoption of a tax rate of 0.109204 for maintenance and operations, which is effectively a 6% increase in the tax rate.
I apologize. That's actually an error. Could you
Okay.
go back and reread that with the first decreased changed to increased?
So it's an increase.
My apologies. That's just a typographical error.
Increased, yes.
Okay. All right. I'll reread that. For the maintenance and operations tax rate, I move that the property tax rate be increased by the adoption of a tax rate of 0.109204 for maintenance and operations, which is effectively a 6% increase in the tax rate.
Thank you. We have a motion. Is there a second? A second by
Second.
Dr. Brinson.
Yes.
Thank you. We have a motion by Manager Zamora. We have a second by Manager Brinson. Okay. There will now be a roll call vote.
Hi, members. I will read each of your names in alphabetical order. When your name is called, please unmute your microphone and state your vote as A or yes to vote for the proposed tax rate, nay or no to vote against the proposed tax rate, or abstain if you wish to be counted as present and not voting on the proposed tax rate. After you have stated your vote, I will repeat it and wait a few moments to ensure you do not wish to dispute the vote as I heard it. Please speak up if I have misstated your desired vote. And with that, I will call the roll. Chairperson Sherry Greenberg.
Yay.
Chairperson Sherry Greenberg votes yay. Vice Chairperson Dr. Charles Bell.
Yay.
Vice Chairperson Dr. Charles Bell votes yay. Secretary Cynthia Valadez.
Yay.
Secretary Cynthia Valadez votes yay. Manager Cynthia Brinson.
Yay.
Manager Cynthia Brinson votes yay. Manager Shannon Jones.
Yes.
Manager Shannon Jones votes yes. Manager Amit Matwani.
Yay.
Manager Amit Matwani votes yay. Manager Maram Musaitif.
Yay.
Manager Maram Musaitif votes yay. Manager Dr. Guadalupe Zamora.
Yay.
Manager Dr. Guadalupe Zamora votes yay. And that is it.
All right, thank you, members. Yes, Manager Musaita.
This is just related to an email that we received from legal that should we be removing our mask for roll call? You mentioned something. I just wanted to clarify that.
What? There was a question, do we need to remove our masks for roll call vote?
David, you sent us an email.
No, ma'am, that was
Yeah.
for virtual participants. All
Right.
of the virtual participants have to do that. The in-person participants are following the rules
Okay,
of the
thank you.
forum.
Just wanted to make sure.
Yes, right. So we are to remain masked. Okay, thank you. So we have now, thank you, members, passed the maintenance and operations tax rate. Manager Zamora, do you have another motion?
I do. For the debt service tax rate, I move that the property tax be increased by the adoption of a tax rate of 0.002610, which is effectively a 343 1/10% increase in the tax rate.
We have a motion by Manager Zamora. Is there a second? Manager Musaita has seconded it. Okay. Ms. Yanes will now read the name of each board member in attendance in alphabetical order. Each member must, when their name is called, answer yay, nay, or abstain.
Chairperson Sherry Greenberg.
Yay.
Chairperson Sherry Greenberg votes yay. Vice Chairperson Dr. Charles Bell.
Yay.
Vice Chairperson Dr. Charles Bell votes yay. Secretary Cynthia Valadez.
Yay.
Secretary Cynthia Valadez votes yay. Manager Cynthia Brinson.
Yay.
Manager Cynthia Brinson votes yay. Manager Shannon Jones.
Yay.
Manager Shannon Jones votes yay. Manager Amit Matwani.
Yay.
Manager Amit Matwani votes yay. Manager Maram Musaitif.
Yay.
Manager Maram Musaitif votes yay. Manager Dr. Guadalupe Zamora.
Yay.
Manager Dr. Guadalupe Zamora votes yay.
Thank you, members. I believe that we have an additional motion, Manager Zamora.
Yes. For the total tax rate, which is the sum of the maintenance and operations and debt service tax rates, I move that the property tax rate be increased by the adoption of a tax rate of 0.111814, which is effectively a 1 4/10% increase in the tax rate.
We have a motion by Manager Zamora. Is there a second? Manager Brinson? Could unmute Manager Brinson.
Yes, I'm seconding.
All right. So we have a motion and a second for the roll call vote. Ms. Yanes will call the name of each board member in attendance in alphabetical order. Each board member must, when their name is called, answer yay, nay, or abstain.
Chairperson Sherry Greenberg.
Yay.
Chairperson Sherry Greenberg votes yay. Vice Chairperson Dr. Charles Bell.
Yay.
Vice Chairperson Dr. Charles Bell votes yay. Secretary Cynthia Valadez.
Yay.
Secretary Cynthia Valadez votes yay. Manager Cynthia Brinson.
Yay.
Manager Cynthia Brinson votes yay. Manager Shannon Jones.
Yay.
Manager Shannon Jones votes yay. Manager Amit Matwani.
Yay.
Manager Amit Matwani votes yay. Manager Maramu Saitif.
Yay.
Manager Maramu Saitif votes yay. Manager Dr. Guadalupe Zamora.
Yay.
Manager Dr. Guadalupe Zamora votes yay. That's it.
Thank you, Ms. Yanes, and members, thank you. As with the budget, Brianna Yanes will be contacting each of you to obtain your signature on the tax resolution summarizing these votes, and that is to be presented to the Travis County Commissioners Court on Tuesday, September 21st, 2021. Thank you, everyone, for your hard work, for the community, for your input, and we are grateful for having this privilege to be of service to our community. And we look forward to continuing to work with our community in so many ways. We know that this has been and continues to be a very difficult time for many. So thank you, everyone. We'll now move to agenda item number 4. Discuss and take appropriate action to authorize the president and CEO to negotiate and execute contracts with general contractor vendors for Hornsby Bend and Del Valley Health and Wellness Centers. Stephanie McDonald will be presenting, and this presentation should last no more than 15 minutes.
No more than 5 minutes.
5,
okay. The next slide, please. Good evening, managers. Stephanie Lee McDonald. Tonight, we are requesting board authorization for the president and CEO to negotiate and execute contracts for general contractor services. This authorization is for 2 contracts, separate contracts, one for the Hornsby Bend Health and Wellness Center and the other for Del Valley. Action tonight allows Central Health to work with the firm selected and execute contracts in advance of your next regular board meeting, which is currently scheduled for October 27th. If you can get the next slide, please. As detailed in the presentation at the August Eastern Crescent Subcommittee meeting and in the backup materials for this meeting, the solicitation method for these services is through competitive sealed proposals. This process is overseen by our procurement manager, Belina Bunch, under the guidance of the Travis County Attorney's Office, and it's very prescribed. Draft contracts are included in the solicitation posting, and all proposers have had to review the contract. A copy of the draft contracts were also included in your supplemental materials. Go to the next slide, please. Tuesday of this week, we received several proposals from general contractors for the Hornsby Bend Health and Wellness Center construction. We hope to see a similar number and caliber of proposals for the Del Valley project next week on the 17th. Action tonight keeps our momentum going as we enter the construction phase of these projects. I'm very happy to answer any questions. We can report back to you on the firms that are selected for each construction project. And I respectfully request your action this evening. And that's it.
Thank you very much. And thank you for the good news. We certainly want to keep the momentum going. We do not want anything to cause any delays. And so we are happy to see this item and grateful to take it up this evening. Members, anything? Manager Masaitis?
Thank you so much for the presentation. I concur with you, Chair. I am very delighted to see this project moving forward. I know it's taken years in the making, but I'm glad that we're hitting the ground. And thank you for all the efforts for everyone. Thanks.
All right. Anyone else?
All I can say is that the people in our Eastern Crescent.
Manager Valdez?
All I can say is I want to thank the people from the Eastern Crescent, the activists and the residents for letting their voices be heard, and for coming to us and asking us for the construction of these clinics that are so long overdue. They have been providing taxes to us since the inception of this district, and we are finally going to give them what they've been asking for. Thank you.
Thank you. Manager Jones.
Yes, I'd just like to echo what my colleagues have said as well. Looking forward to these. I was just wondering if the CEO could speak at all, just briefly, about any time frame or any timeline on the other one in this area, Colony Park.
Thank you. Mr. Giesler?
Council, are we properly posted
Oh,
that I can respond?
No.
no. Okay, I'm sure that you can take that offline.
Yes, I just want to acknowledge that the work being done in Colony Park is the point of what I was trying to get at.
Yes, yes, indeed. We know that there is a great deal of work being done in Colony Park, and we will get further updates on that. Thank you. Manager Bell.
Chair, I agree with you, Chair, and the other members that we surely do not want to delay any work on the Eastern Crescent clinics. And with that, I'd like to move that the board authorize the president and CEO to negotiate and execute contracts for general contractor services for both Hornsby Bend and Del Valley Health and Wellness Centers with terms similar to or more favorable than presented.
Thank you. There's been a motion by Manager Bell. Is there a second?
Chair, I second.
Manager Musaitis has seconded. Any more further discussion? Seeing none, all those in favor vote aye.
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 Opposed, nay. Any abstaining? Thank you, managers. Very exciting to see this progress. And with that, we come to agenda item number 6. Confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is scheduled for Wednesday, October 27th, 2021 at 5 p.m. We have not yet settled on a location for the meeting, but you will be informed as soon as we identify one. At this time, I'm ready to set a motion for adjournment. Manager Valdez moves to adjourn. A second.
I second.
Mr. Brinson seconds that. All in favor? Aye.
Aye.
Opposed? Same sign, abstaining? Members, we are adjourned. Thank you, everyone, and
Thank
thank
you,
you to the
members.
community.
And good night
Thank you,
to the
staff. Thank you,
community
team.
who's watching us.